Greetings everyone, I am Elisa Fall and I'll be discussing a patient referred to as Mrs. Teresita Manolos who has been diagnosed with an embolic stroke. Nonetheless, prior to delving into specific about her circumstances, I want to discuss about embolic stroke. So, are you aware that embolic stroke ranks as the second leading cause of stroke? Individuals diagnosed with an embolic stroke are often relatively young. According to an Australian Commission on Safety and Quality in Healthcare, a stroke happens when there is an abrupt disruptions in the blood flow in the brain. This results in some brain cells dying, causing an abruption loss of the abilities like speaking, swallowing, thinking, and moving. Additionally, as stated by Cooper and Gosnell 2023, it typically originates from the thrombus in the heart's endocardial, which is in the layer, which can be triggered by a rheumatic heart disease, mitral stenosis, atrial fibrillation, and a myocardial infection, endocarditis, and valvular pathesis and atrial septal defects. Even with progress in treating individuals with heart failure, the death rate remains significant. Here are the several figures regarding the death rates according to Australian Bureau of Statistics in 2024. Now let's examine how this connects to our patients. Mrs. Manolos' situation employing the A2G evaluation method. So her airway is open and unobstructed. Patients are lethargic with GCS 12 out of 15. For clinical decision as a nurse, these signs suggest that while she can currently maintain her airway, there remains a risk of airway obstructions if her level of consciousness worsens. We need to keep a close eye for any blockages if her GCS falls below 8, as that would necessitate intubation. For breathing, respiratory rate is 26, which is tachypnea. Oxygen saturation is 95% on room air, which is between the flag through Hudson mask. For clinical decision, auscultation reveals equal air entry but reduced the breathing sounds, suggesting potential hypoventilations. Maintain supplemental oxygen. Target as oxygen saturation levels over 95%. And then escalate if the braking work of breathing deteriorates or oxygen saturation decreases. Nonetheless, we can attempt some activities like breathing exercises or posture that may enhance the ventilation. For circulation, heart rate at 132 beat per minute and blood pressure recorded at 170 out of 95 millimeter mercury, which is hypertensive. There's some chill extremities causing swelling in toes. For clinical decisions, given her cool peripheries and pitting edema on her feet, it was suggested that she may have cardiac output issues or fluid overload. And atrial fibrillation accompanied by tachycardia raises the likelihood of additional embolic occurrences, as noted by Saver and Hankey 2020, which also noted that a hypertensive response characterized by elevated systolic blood pressure is worrisome because it is frequently accepted after a stroke to maintain cerebral perfusion through extremely high pressure that can then heighten the risk of intracranial hemorrhage. For disability, GCS 12 out of 15, as I mentioned above. Speech slurred, left hemiparesis, drooping face, pupils equal and responsive to light. These results aligned with an acute embolic stroke affecting the territory of the middle cerebral artery. According to Sabin, Hankey 2020 proposed that neurological monitoring should be take precedence, as any additional decrease in GCS or loss of reflexes necessitates immediate intervention. Exposure, afebrile, no injuries, IVC, placed in left cubital fossa, fluids infusing at 20 mils per hour, which for glucose blood sugar level is 5.5 millimole per liter, which is between the flag. Clinical choices, being afebrile and having normal blood sugar levels are very important. since both can exacerbate neurological damage. As Saver and Hank in 2020 recommended to proceed and track the consistency of stroke symptoms and indicators like hypoglycemia or sepsis. These presentations will additionally addresses 4 essential nursing interventions for Mrs. Teresa Manalo's embolic stroke, along with her appropriate medication and the nursing considerations that will be emphasized. So here are the 4 priority nursing interventions for Mrs. Teresa Manalo's. One is to ensure airway patency by positioning in semi-high Fowler and supporting the weak side with pillows while providing supplemental oxygen to maintain oxygen saturation above 95%, keeping suction at the bedside and being ready to escalate to advanced airway if GCS decrease. Additionally, maintain Mrs. Manalo's nil by mouth status and ask for speech-language pathology. Evaluation activation the stroke pathway is also crucial, and organizing a CT of the brain. Conduct a thorough baseline neurological evaluation, because if any neuroscience worsen, such as pupil alterations or decreases in GCS, we can distinguish and respond promptly, as timely intervention can decrease disability and hence survival rates. Also, to initiate ECG monitoring for Mrs. Manalo's because of atrial fibrillation with a rapid ventricular response, monitoring her blood pressure regularly and adhere to the protocol for managing hypertension. Additionally, to observe the cardiac arrhythmias, since unmanaged blood pressure can elevate the risk of stroke and adverse outcomes. Fourthly is to consistently track her existing anticoagulant medication, since anticoagulant medication are crucial for secondary prevention in atrial fibrillation but can contraindicate thrombolysis and heighten the risk of intracranial hemorrhage. And having a correct medication can also avert complication and yield better outcomes for patients like Mrs. Manalo's. I have chosen 3 medications, such as IV alteplase, IV heparin infusion, and metoprolol for the 3 medication with nursing consideration. So according to MIMS 2025, IV alteplase is indicated to use in adults for the lysis of acute ischemic stroke, pulmonary embolism, and myocardial infarction. This medication is indicated to dissolve the cerebral clot and restore blood flows for Mrs. Manalo's who is experiencing embolic stroke. Nursing consideration prior administration includes having a thorough assessment and eligibility and contraindications such as Manalo's hypertension. Baseline neurological status, vital signs, and any symptoms of blood clotting. These can help by detecting any changes that may indicate any complicating bleeding. Alteplase is administered through a dedicated intravenous line using an infusion pump according to the weight-based protocol, with careful monitoring and a high dependency on stroke unit. Nursing care focuses on frequent neurological checks and vigilant observing for any signs of bleeding, including gums, urine stool, or sudden neurological deteriorations, as well as monitoring for hypertension and nausea. Prompt detections of clinical detection of complication ensures safe and effective thrombolytic therapy tailored to the embolic stroke context. For the second medication, heparin infusion, in Mrs. Manalo's case of embolic stroke, heparin IV is recommended for the prevention and treatment of thromboembolic issues, including thrombophlebitis, pulmonary embolism, and occlusive vascular disease. Heparin is given through an IV infusion pump, preferably using a dedicated line with doses verified twice. These drugs are utilized to avert additional embolic incidents, especially because Mrs. Manalo's has atrial fibrillation. For the last medication, metoprolol, according to EMIS Elite 2024, serves as a beta blocker that can be utilized alone or alongside other antihypertensive medication. Mrs. Manalo's has been diagnosed with atrial fibrillation and a rapid ventricular rate of 132 beats per minute. Metoprolol can aid in reducing the heart rate, which helps avert additional embolic incidents. Prior to administration, it is essential for us as nurses to evaluate her heart rate and blood pressure, as metoprolol needs to be withheld if the heart rate is under 60 beats per minute. In our situation, her heart rate is 170 out of 95 millimeter mercury, which makes it suitable to administer, and there are no intra-contradictions. These drugs should be administered 2 times a day with meals or via intravenous methods at 2.5 to 5 milligrams slowly over 1 to 2 minutes while monitoring ECG. In nursing consideration, it is essential to stay alert to side effects like hypotension, bradycardia, and fatigue. Thank you. And here are the references according to the presentations above, and thank you for listening.